Hello guys, this is Dr. Mohammed. Welcome to our channel. So today's tutorial will be about all chromosomal diseases. So let's get started. So what is very important for the competitive exam is you should not miss any question which is direct type of question, like which can give you 1 mark to pass. So for today's discussion I'll be talking about all the chromosomal diseases in nutshell. So for chromosome 1, it's Rh system and neuroblastoma. As you know, Rh system is for erythroblastosis fetalis. It's very important, and for neuroblastoma, it's the most common cancer in the infancy, and it's the most common cancer in the kidney in the childhood. So for chromosome 2, we have cystinuria and hypobeta lipoproteinemia. For chromosome 2 RCC, that is renal cell carcinoma, as you all know, that is von Hippel-Lindau gene, and alkaptonuria, you see black color urine. For chromosome 4, you have Huntington's chorea. Huntington's chorea is seen in it's a non-functional protein called ubiquitin gene. So ubiquitin is for protein reformation and breakdown processes. So in the brain, for Huntington chorea, the symptoms you can see like the sudden jerky movement or something like that. And achondroplasia is you see rhizomelic growth, that is inappropriate growth in during childhood. So and you see bullet shaped vertebra in achondroplasia. And for Parkinson's disease, there is a protein called alpha-synuclein. There will be defect in alpha-synuclein, and what you can see in the microscope is Lewy body basically. So there is a triad of diseases in Parkinson's disease, that is tremor, rigidity, and bradykinesia. For chromosome 5, we have familial adenomatous polyposis. When we can say that is familial adenomatous polyposis, we should have more than or equal to 100 polyps, then only we can say that it's FAP. So it's if you have more than 100 polyps, that means you have 100% chance of getting in colorectal cancer. So the suggestive, the absolute treatment, and there is only one treatment is sigmoidectomy. So colorectal carcinoma, Cray-Duchat syndrome, we have in these babies we can see very high pitched cry kind of thing. And for chromosome 6, it's the HLA system. As you all know that we need for organ transplant, we need HLA system, especially for kidney transplant. And chromosome 7, cystic fibrosis, that is CFTR gene mutation. In CFTR gene there is NSL transport chain, we have problem with that. So chromosome 8, we have osteoporosis, it's not so important. Chromosome 9, ABO blood group system, it's very important. And Frederick ataxia, we see in the chromosome there will be a repeat sequence of GAA protein. There is amino acid chain. There will be in mRNA, there will be GAA repeat sequence. It's more than 30 we need to get Frederick's ataxia. Chromosome 10 is Apert syndrome, it's not so important. That is what we can see in this, that there is two forms like reniosinostosis and syndactyly. Charcot-Marie-Tooth, this is Cohen syndrome. In Cohen syndrome we can see xeroderma pigmentosa. And Cowden syndrome, there is a problem with PTEN gene. PTEN gene is responsible for breast cancer, thyroid cancer, uterine cancer, and kidney cancer. MEN syndrome is very important throughout your whole medical life. That is MEN 1, MEN 2. MEN 2 has two divisions, MEN 2A, MEN 2B. In MEN 2A and MEN 2B, pheochromocytoma and medullary thyroid carcinoma are very common in between them. So for MEN 2, what is different is parathyroid hyperplasia. It's very important to know that it's parathyroid hyperplasia, not hypertrophy or parathyroid cancer or parathyroid tumor. It's hyperplasia. And for MEN 2B, it's Marfanoid syndrome. Usher syndrome, that is hearing impairment and vision deficiency, so can't see and can't hear anything, the patient, that is Usher. For Ullmann, it's a lysosomal acid lipase deficiency. Chromosome 11, we have sickle cell anemia. That's a substitution mutation in which we can see glutamic acid is replaced by valine in the chromosome number 11, that is beta globin chain. Beta thalassemia and Wilms tumor. Wilms tumor is very important. We'll make another video in this. We'll discuss about Wilms tumor, and it is second most common cancer in the kidney in childhood. Yes, Wilms tumor. Okay. Next is main 1 and Ataxia Telangiectasia. In main 1 we have PPP, that is pancreatic, parathyroid and pituitary, and again it's parathyroid hyperplasia, not parathyroid tumor. For Ataxia Telangiectasia, the patient has like stepwise in throughout the years the patient gradually develops first ataxia, then telangiectasia, and then finally the patient by 7 to 10 years of age the patient goes into death. Chromosome 12 is PKU, that is phenylketonuria. In phenylketonuria, sorry, I forgot to write here, that is we can see is musty odor urine, that is musty odor urine. And von Willebrand disease is a blood coagulopathy in which the factor is defective, so the external pathway of the blood coagulation cannot occur, so it's a addition defect, so the bleeding time is increased in these patients. So in chromosome 13 we have retinoblastoma. It's very important, the flexural Winstead rosette. What kind of rosette? Very frequently asked in the exam. And the leukorrhea is the most common presentation in this type of patient. Leukorrhea is what you see like a cat eye kind of thing in the patients. It's very easily identifiable. You can see through googling this image. So for Wilson disease we have the ATP7B gene, which is responsible for there is a imperfect copper transport mechanism. Because of that there are lots of copper deposition in the liver and kidney and heart and eye, the iris of the eye, which we call the Kleischer-Fleschner ring. And chromosome 14 we have familial HOCM. In this the myofibrils of the heart are disarranged improper way, and alpha-1 antitrypsin deficiency, in which we can see in type of bronchiectasis is a part of COPD, so we'll make a different video on that. So chromosome 15 we have Marfan syndrome, which is the fibrillin 1 gene is responsible for Marfan syndrome. And another disease is albinism. And Prader-Willi and Angelman, these two are very very important as for the chromosome 15 per se. We can see, so we can see genomic imprinting in there. That means in there is a very good mnemonic in that. So Prader means it's a pa means daddy, so there will be mutation in the there will be deletion of the fathers, and there will be imprinting of the mothers, and Angelman is vice versa. So that's called we'll elaborate this in a different video. These all things, the key terms I have written here all together, which by which you can very easily identify the what exactly they are asking in the question. Like the ATP7B, you can answer Wilson disease. If you see bronchiectasis, that is alpha-1 antitrypsin deficiency. Like genomic imprinting, these two will be there. Prader-Willi syndrome or Angelman syndrome. So for chromosome 16 we have alpha-thalassemia. These are broad topic we cannot discuss in very short term, as you all know, and all of us know what this all, especially those who are going to write the NEET or